Why do babies cry when they're born? Well, there's nothing like hearing that first cry after your baby is born to reassure you that everything is okay. But have you ever wondered why babies cry at birth? It's because they're unhappy that they had to leave the warm womb to face the cold, cruel world. Turns out the answer is just so beautiful that the first cry can be music to a new mom's ears. It's a sign that baby's lungs have begun functioning outside of the womb, which is integral to baby survival. Remember, a baby breathes in a utero via its mother's placenta. When a baby is in the womb, amniotic fluid fills in air sacs within lungs. However, a baby is being born and squeeze its way through the vaginal canal. Pressure on the chest will compress to it, literally squeeze the fluid off the lungs. Think of a baby's lung as being sponge full of water. Once the baby is born, all of the water now has to be replaced by the air. And that's why baby's first cry is so critical. It's the first time that the lungs are actually being used to breathe. Although the first breath might be short one, the exhaustion of the breath, which is baby's first cry, tends to be longer because it's the pressure forcing the air sac open and getting the fluid out. Your baby might not let out just one sound, wah, but several cries depending on how much fluid he or she may be expelling from their lungs. Your baby will cry as long as they need in order to start their breathing normally. But if you think that your baby cries at birth because he was upset or she was upset and they had to leave this wonderful life inside of the womb, just think again. Babies don't cry initially because they're complaining. Within the 5 to 10 minutes after birth, persistent crying could be a breathing issue, or sometimes they're just cold, which is why they're always an infant incubator and radiate warming machine in the delivery room. And once they're all cleaned up, babies are also swaddled after birth to help prevent body heat loss and keep them calm too. So how much crying can a mom expect from a newborn? Ideally, you want to hear a couple of good cries. Once they've opened up their lungs, they're being soothed and warmed, and then they'll stop crying. For the most part, healthy newborn taking his first breath will cry for about a minute or less, and your baby cries will be part of his or her overall score in their in ESPER respiration that they take at the hospital. Also, this test does include right after birth, after like 5 minutes or so, although newborns cries and what everyone is cheering in the delivery room. Sometime an OB might delay the baby's first cry if the baby passes vacuum baby's first poop during labor or delivery. The labor and delivery team will work to clean the baby's first poop and get ready for them to have skin-on-skin contact with the mother. So there's a big differences from like when your baby is delivered to when she takes her first or his first cry. When they're born, they're lifeless and purple, and when they make their first cry, it's like a magic. They turn into baby. Suddenly the baby goes from being purple to pink. They start moving as well, even opening their eyes to see the first world for the first time. Crying is the key to life. It's a really miracle, you guys. Now tell yourself at 3 o'clock in the morning when your little miracle is full of crying and you know it's full of life. So yeah, there you guys have it. What happens during the first few minutes after baby is born? Baby should start crying and breathing, which means their lungs are functioning properly. If everything is all right and your baby doesn't require any special help, the nurse will place the baby on your chest for skin to skin contact, or he may first dry your baby and cover the little one with warm blanket or towels. Soon after birth, the umbilical cord will be clamped and cut. Your partner may be allowed to cut the umbilical cord. However, if you had a C-section and any other complication during delivery, your doctors will cut the umbilical cord, so don't worry about that. Your baby may look blue or purple in initial few minutes of birth, but that's totally normal, you guys. If baby's breathing okay, the skin color will gradually turn pink. Sometimes the baby's head and feet may stay blue for days because the blood vessel in your baby's limb are tiny, and it may take up some time to circulate properly. Your baby's face and eyelid might be puffy or swollen, and the feet and legs are little bowed or bent, but that's how they were in utero and will soon turn normal. Yes, so all babies cry at birth, you guys. The first cry after birth signifies that baby's lungs are functioning well and they are able to breathe. However, some babies may not cry immediately after birth. If baby's first cry is delayed, they may need to stimulate it by the doctors or nurses in case of emergency C-sections. So it's so crucial for your babies to cry within the first few minutes after their birth because it means they are able to breathe. While in womb, babies breathe through their mother's placenta and breathe in amniotic fluid. However, once they're born, they must squeeze out all the amniotic fluid from their lungs. If baby cries at birth within minutes, amniotic fluid gets replaced by lungs and lungs begin to function. During birth, babies feel a lot of pressure on their chest and are unable to breathe. After they are delivered into the world, the pressure eases. The baby's breathing reflex will kick in. Your little one will soon cough out the fluid, blocking their airways, and begin to breathe air with their lungs. So the bottom line, you guys, is now that you know why babies cry after birth, it is something you should be proud of. You should enjoy these first cries of your baby because it's the sign it's the sign of their lungs are functioning as well. They are awake and alive. And some newborns may continue to cry. That's just because they are taking longer to transition from womb to the world. So if this video was helpful, do comment below.